your dissection manual, Cunningham's or whatever it is, you just, the main thing that you have to distinguish between thoracic vertebra and cervical vertebra. Cervical vertebra, typical, atypical. Similarly, in thoracic vertebra, will be typical, atypical. At the general features of any vertebra, you have to know first, identification. And similarly, now we have come, head neck ta pore hobe, naturally cervical kotha asche na. You have to see, I told you, evolution of erect posture, I showed you the other day. Now, you have to see the body weight and how they evolved and we became erect. Naturally, the body weight transforms and the whole thing, like you see the Sherpas trekking Mount Everest. So, they are having their total load and in the rucksack, whatever it is. And also the coolies in Howrah station. But they are a vanishing clan. Aste aste coolie practically kome geche. Kome jacche. Now, the total weight, agata coolie se dute, tinte, ekhane ekta jhola, you see in that load, as even in the ordinary truck unloading, loading, now the back muscles, the anterior portion supporting the vertebral column, and this is what we have, is gradually the size increases. Now, mala. Now, this is I call mala of the vertebral column. Now, you see, this is the cervical vertebra and this is the lumbar vertebra. Gradually, the thickness, width, breadth, that is increasing. Even the lamina processes. This is the common descriptive features. Now, what you have to touch kore nebe tomra. That common description is there. It has processes, spinous process, transverse process, lamina, and the thickness of the spinous process is more than inch. According to the person, how much healthy means a thin person can be a healthy person. But I'm talking about muscular and weightlifters. And muscular man or woman have their vertebral column larger size. Now, but the description is the same. You go, the vertebral column are supported by, interposed by intervertebral disc, and the arch makes the spinal cord descends. Now, gradually it will grow and go and thicken and then ends in the lumbar region. So, if there is any disc prolapse or any fracture or any pathological condition related to the spinal cord will be depicted in if you take an X-ray, but MRI will give you a true picture of the. Previously, I showed you when I gave you a lecture on the vertebral column and evolution of erect posture. Now, one thing what I want to say is that now this is the vertebra you are seeing in superior view, like this, spine posteriorly. Now, from opor theke dekhchi, you are taking the picture of in a marriage party by drone. So, you are looking at the on the superior surface. Now what is the picture? Is that, see, this is the vertebral, this is the arch that is broken. Now the relations of the vertebra to the muscles and ligaments and tendons, and see, it has to be supported. So that is one thing, is that now this is the crus of the diaphragm, this is the anterior longitudinal ligament, posterior longitudinal ligament, this is a basivertebral vein, basivertebral vein. This is very important because if any metastasis goes for in breast cancer or this thing, it goes and the basivertebral vein. Now metastasis go there, so there might be all of a sudden the patient or the person complains of a pain, acute pain, and suddenly that is the fracture. It can happen in tuberculosis, it can happen in malignancy, but I'm talking about metastasis going through the basilar vein. And what happens? But this thing that the person doesn't collapse, but the muscles, he starts, there's anteriorly some ligaments and muscles there supporting the spinal column. Posteriorly there's some muscles and ligaments that is supporting. Now, this is a very simplified picture. Now this is the lumbar artery and psoas major and tendinous arch. When you dissect the tendinous arch of the diaphragm and the diaphragm crus, right crus, left crus, right 3 lumbar vertebra, left 2 lumbar vertebra, the attachment is there. Now, this is the right lateral view. Now, from laterally, the thing is cut off, and you see the psoas major muscle, the lumbar artery is laterally. Now, crus of the diaphragm, posterior longitudinal ligament, right lateral view. This is the right lateral view. Lumbar artery, anterior longitudinal ligament, this anterior, this is the spine, this is spine, and the crus of the diaphragm. This is lumbar artery, this is the psoas major muscle, posterior longitudinal ligament. Now this is the another picture on the this is the vertebral body. This is spine, this is the canal, vertebral canal, this is the transverse processes. Now the spinal nerves, radicular artery. Now interspinous muscle, interspinous. মানে দুটো স্পাইনের মধ্যে interspinous, এটা তো হোল্ড করবে like this, interspinous, that is interspinous, the interspinous muscle in the posterior lumbar of thoracolumbar fascia. This deep muscles of the back, you feel your own muscles. You see your friends, tell them to stand out, and you feel the muscles. Similarly, you girls, just see your own body and your friend's body is the most good to study on. ঠিক আছে? Now, see the lumbar vertebra. This is the muscles, the transverse muscles, medial transverse muscle, lateral intertransverse muscle, medial muscle, lateral muscles, medial muscle, posterior longitudinal ligament, and anterior longitudinal ligament, and the psoas major muscle, and thoracolumbar fascia. There's a beautiful picture. Next I will show you. Even you'll be taught, see, full question, the marks on 5 marks or 10 marks will be thoracolumbar fascia. Okay. And what you just what I'm trying to stress is that if you get a short note, thoracolumbar fascia or psoas major muscle, then you have to mention their attachment to the vertebral. So, but one thing, you stand this anteriorly, you describe the anterior longicular ligament, posterior longicular ligament, then your crus of the diaphragm, right, left. It is a repetition. Osteology, no, it is a repetition. Thorax, what I want to say is that you visualize, you try to correlate the lectures, demonstration, and then you read the book. Okay, whatever it is, I told you one thing, mantra, because after lunch, you don't leave the hall. You sit in the hall, you sit in your demo room, see the specimen. Don't have to carry bones. You get an artificial bone, whatever it is, you carry your bone, it's all right. But you can issue. Acta bone nindile, you sign and take it. Let at least the gross features. When will I ask you where is the position of the artery, nerve, spinal nerve? When? You cannot identify a vertebra, you cannot distinguish between lumbar vertebra, between thoracic vertebra, lower thoracic vertebra with upper lumbar vertebra. Then why should I waste my time asking you small minor questions? At examination, mindset toiri hoye thake. When you ask to lift up lumbar vertebra, the mindset তৈরি হয়ে গেল, তুমি যেটা নিয়ে ঘুরতেই থাকলে তুমি দেখে নেবে এইরকম সাইজের কোনো ভার্টিব্রা নেই। দিস ইজ লাম্বার। আর থোরাসিকে কি একটা ফ্যাসেট থাকবে, ফ্লোটিং রিবসের জন্য একটা ফ্যাসেট থাকবে। You have to identify now this size and robustness, একটু মোটা সোটা। Like you say, বরবটি, you know বরবটি, dal, it is a bean, it is a bean. Now, even there is one bean that is known as rajma, and this barboti I cannot, this thing I'll tell you on the next day, the Hindi of it. The bean, it's a bean. Now bean of different types of beans are there. So you think of lumbar vertebra as a big bean. Am I clear? And it has to কি আছে, মাসল আছে, এত আছে, এটা মাথায় তুমি খালি posterior column কে support দিতে হবে, muscles দিতে, posterior ligament, this thing, about anterior ligamentum flavum, all these muscles come in. Okay.